Hello, everyone. Welcome back to week 6 lecture, Introduction to CPT, HCPCS coding, last chapter in the surgery section. Woohoo! Let's dig in. Auditory system and the operating microscope. You know the deal. We have all of these objectives, same chapter, blah, 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 blah. All right. So the auditory system enables a person to hear and maintain balance when the head and body move. Okay. The structures of the ear actually pick up these sound waves that are then interpreted by the brain. So let's dig into some of this anatomy. So, the auditory system is divided into three regions: the external ear, the middle ear, and the inner ear. So if you ever heard of otitis media, that makes sense. So the external ear is visible, it's the outermost part of the ear and is not within the structure of the skull because this kind of sticks out, right? There are two structures that make up the external ear: the auricle and the external auditory meatus. The auricle is also known as the pinna, which is a flexible cartilaginous flap that has a bottom portion known as the earlobe. The auricle sends sound waves to the ear canal, which is known as the external auditory canal or the external auditory meatus. Along the external auditory canal, tiny hairs are called cilia that aid in transmitting sound waves inward to other auditory structures. All right, so the middle ear is made up of the auditory ossicles. Another name for the middle ear is the tympanic cavity. The auditory ossicles are three small bones that transmit and amplify sound waves. They are named according to their shape: the malleus, which is like a hammer; the incus, which is like an anvil; and the stapes, which is like a stirrup. All right. And then, so I talked about the middle ear, I talked about the external ear. Oh, I didn't talk about the inner ear. What do I want to say about the inner ear? Well, the middle ear is separated from the inner ear by the oval window. And within the inner ear, also known as the labyrinth, we have bony structures and membranous structures. All right, that's enough about that. I already talked about this. See, I got notes. Then there's stuff on the slide. So I talked about that. Cerumen. You ever heard of ear wax? So, within the external auditory canal are sweat glands called ceruminous glands that secrete a honey colored, thick, waxy substance known as earwax or cerumen. Cerumen helps to protect and lubricate the ear, and in combination with the hair, the cilia, the cerumen helps protect the eardrum from foreign objects. The eardrum, coincidentally, is known as the tympanic membrane. It separates the external ear from the middle ear. The tympanic membrane is a thin, semi-transparent membrane, silvery color in silvery gray in color, and it transmits sound vibration to the inner ear through the auditory ossicles. And what are the ossicles again? The malleus, hammer; incus, like an anvil; and then the stapes, which is a stirrup. All right, so I talked about that already. Oh, I talked about that too. So let's just keep on rolling. The eustachian tube. Eustachian tube is also known as the auditory canal or the pharyngeotympanic tube. Pharyngeotympanic tube. And the purpose of this tube is to equalize pressure within the middle ear, and it separates the middle ear from the inner ear using the oval window. That kind of makes sense, right? The bone labyrinth, it's bone and membrane structures. Then you have the vestibule, and that is the central portion of the inner ear. It has some membrane sacs that aid in maintaining our balance. We have the semicircular canals, and these are located behind the vestibule. And these are three bony structures that are filled with fluid that also help to maintain balance. When you know how powerful your body is, it makes you, want to protect it. And I'll just tell you, as someone who had a fracture last year, that it has been a struggle to, do basic things like just be able to walk again. Okay. And walk with stability. All right. The last part, inner ear, is the cochlea. It's a snail shaped bony structure that contains endolength and perilength. Endolength is auditory fluid that transmits sound. Perilength, auditory fluid that also transmits sound. So it's where the hearing takes place. And if you have trouble hearing, that's when you get a cochlear implant. That's something we'll talk about. All right. And then, of course, we got abbreviations. All right. There are guidelines. There is a reference to what is coded in the auditory system. You saw that with the eyes, and now you're seeing it with the ears. Procedures that are completed on the external ear are grouped together by what you've seen in other sections: incision, excision, removal, repair. All right. You have in the incision and excision codes for ear piercing, biopsies, incision, and drainage. Are you like, okay, I'm at the end of the surgery section. I see, the trend. Okay. All right. Then we have codes for removal of foreign body and debridement. When we talk about impacted cerumen, we have two code options. One there where we do an irrigation lavage, and then the other where we need to use instrumentation. All right. So when we talk about the repair options, lots of notes over there as well. And I don't know if you figured this out by now, but there's just notes, right? There's notes everywhere. One note is telling us that if we have to suture wound or injury to the external ear, to go back and grab those codes from the integumentary system. This code range also, they make notation about bilateral procedures. So just things that you need to read before you go and take a national exam, because on the day of the exam is not the time to be reading those notes. All right, procedures on the middle ear. You have same thing: incision, excision, repair, etc. As it relates to incision, you have procedures that are very popular, such as putting in the eustachian tubes. Those tubes are also known as ventilating tubes, which allows the fluid to drain. And this is something that's done when patients have chronic ear infections. And so the procedure is very tricky because you see the word tympan and myring. So a myringotomy is where they are opening the area, and it includes aspiration and or eustachian tube inflation. Something else you'll notice over here is there's differentiation about if general anesthesia is used or not. If it's a bilateral procedure, you're going to use a modifier 50. There are also codes for just removing the tubes. If they do an incision and put in the tubes, you have codes for that as well. All right, moving along to excision and repair. So here you're going to see things like mastoidectomy. And with this mastoidectomy procedure, you have to know if it's complete, revision, radical, simple, so forth and so on. You also have resection procedures, and then you have myringoplasty, tympanoplasty, and tympanic neurectomy. Next up, we have codes for so bone, integrated implants. And this is a device that is placed in the skull to treat hearing loss. Every year, they're coming up with something new to treat conditions that patients have. Yeah, review the notes, review the notes, review the notes. When you know the guidelines, you can code most anything. All right, back to business. Procedures on the inner ear are organized like you've seen before: incision, incision and drainage, excision, introduction, destruction, you name it, we can code it over there. All right, the temporal bone middle fossa approach. Oh, I just thought about something I saw on TikTok. Aaron, Pierre, that's Mufasa. All right, I've clearly had too much caffeine today. Temporal bone, middle fossa approach. These procedures in this particular range include vestibular nerve section, facial nerve decompression of the auditory canal, and removal of a tumor. And last, and certainly not least, the operating microscope code. This is a code that is reported with any procedure except, except except if the procedure is not excluded from this long list. And I don't know, I feel like this list gets longer and longer and longer and longer every year. All right, so we did all of this. It is over. We are done with the surgery section. Next week, we're going to hit radiology, laboratory, medicine, and then finally HCPCS. I hope you have your HCPCS manual. Bye.